Hello, everyone. I've got Ashley here with me, the owner of Willow Park Rejuvenation. And today we're talking, she's spilling the secret sauce on how to convert cold leads into clients. So we've worked together for, I want to say about a year, if not more now,
Mhm.
right?
Right.
And she converts like nobody's business. She converts anywhere from 60 to 70% of cold leads. These are people who have never heard about her business, and she converts them into clients. So I'm sure all of you watching are going to be really appreciative of learning what that secret sauce is. So, Ashley, anything you'd like to add? Anything about your business?
No, I think a lot of us as business owners just it's the most challenging part, is driving traffic and not just driving traffic, but how do we handle that traffic? How do we convert that traffic and turn them into a patient, a lifelong patient? So that's one of the number one challenges I think that almost every business has. So I'm happy to be here and be a part of this to help you, help us, help everybody.
Thank you so much. Tell me a little bit about your follow-up schedule and strategy. So from the moment you get a lead, what's your process? What's your follow-up process?
Well, the really the biggest thing is making sure as soon as they come in, get them while they're hot.
I
So
love,
follow up
love that.
when I get them while their fingers are still on that phone. Give them. I usually will give them a call first. If they don't answer, I'll send them a text message and I'll also email them.
Oh, you
And
email them as well. So you do
I do.
three touch points.
I do. I send them an email, and I if I get them on the phone, of course, I'll explain. In this case, we're doing weight loss, so I'll explain everything about the weight loss, the benefits, the potential side effects. It takes all of 5 minutes. It's pretty quick, so I think that's important to remember when you do follow up with these clients or leads, to keep those bullet points in mind of how can you stay on track. If they're reaching out to you and it's for weight loss, these are the benefits of this injection, these are
Hmm.
the potential side effects. And most usually when they give you a call, they're already ready. Weight loss is always number one because everybody wants to lose weight, but what
Yeah.
sets you apart, make the phone call personable, not just robotic and like car salesman energy. And I think one of the biggest things is when you're talking to someone, your energy speaks louder than words.
Hmm.
So if you think, how can I help this person, not how can I help me get this sale,
I love that.
that paradigm shift will remove the number one thing that causes people to sometimes not always be the best in this position, and that is the fear of rejection. So
Hmm.
it eliminates the fear of rejection if you think about how can I help them, not how can they help me. So if someone decides, oh, this is not a good fit for me, well, then what I'm going to do is I'm going to tighten up on my energy. I'm going to tighten up on my communications, and education sells, but the energy behind the message, I personally believe, is the
The
biggest
most
sell.
powerful, huh? Interesting.
And when you really take that into your, and if you really take that and change your mindset, because I can teach you can teach anybody to do anything, but when you get your mind right and wrap it around how can I help you, not how can I help me, it makes it about them, and you automatically deliver that message that we care about you and we're here to help you. We're not
Hmm.
here just to run a transaction. Yeah.
I love that. And when you talk to them, of course, a lot of the times, because of weight loss, I mean, it's not the cheapest, it's not a facial, right? So, how do you handle when it comes to price objections? If somebody says, "Oh, I don't know if I have the money right now."
Well, if they don't have the money right now, what we'll do is we'll go through payment options. And one of our most popular payment options is Care Credit. So let's say you take a program. Like, for example, we've got the semaglutide 12 weeks is $849. But if they want to do 24 weeks, they save 100. So there's an incentive. The longer they go, they'll save $100. But to really get it into their mindset of, if I don't have that money up front, tell them what that monthly payment will be. So I know in my mind that a care credit payment for 12 weeks or 3 months is $144 because we're pushing it out. If I remember correct, I don't have my calculator. You guys can call me out if you want, but really I'm sharing perspective. It's $144 and we're pushing that care credit payment out to 6 months when we do that. But if they do the 6-month program, then the payment is $133. So it's actually smaller for them to go further, and they're saving an additional $100. So that's how I'm getting those transactions.
I love it because it brings me into my next question, which is exactly because one thing we're testing out right now is starting with the lower offer, right? But
Mm-hmm.
obviously you want them to stay long term and you want to upsell them. So my question, that's exactly what I was gonna ask you, is how do you upsell them into a bigger package? Because obviously, number one, if they sign up for a longer period of time, it's beneficial for them because they're more likely to attain their goals. Obviously, it's good for the business too. So that's is that how you approach when it comes to like selling them into bigger packages? Because this is where I think a lot of business owners struggle with how do I make that sale a little bit of a
Mm-hmm.
bigger sale?
Well, the longer they commit, the longer I tell them I can push that care credit out, and there's no prepayment penalty. And with our office, we also don't charge interest to the patient. So it's
Mhm.
essentially a free loan. So if they're going to pay $144 a month for that 849, they have to ask themselves, can I afford $144 a month? And there's no money up front with care credit. Um, or do I want to go and jump into the 6 month and my payment's 133? There's no obligation to do that. But then the next question you're probably going to have is, how do you determine how much time they need to be on it? So our
Right.
medical director, and this is another thing in the medical world, we have to be mindful of our communications when we're not doctors. So not to I don't communicate consultation for myself. It's a screening for a patient. So it's a matter of, once they call, I'll ask them a series of questions. Um, and then one of those questions is, what do you weigh and how tall are you and what's your weight loss goal? So let's say they have a weight loss goal of 30 pounds. Our medical director says that, well, a safe amount of weight is up to 10 pounds a month. So sometimes people will lose a little less, maybe they'll lose a little more, but when they start to lose more than 10 pounds a month, they run the risk
Yeah.
of losing muscle.
Yeah. Which
Okay, so if that's the case, then you know that a 3-month program is going to be up to 30 pounds. But then there is a maintenance period. If someone wants to lose 30 pounds, we know that 3 months is a good amount of time to lose that weight. But then maintenance is 2 to 3 months also. So then I'll break it down and explain to them the way that our doctor prescribes. And I don't know if you want me to go ahead and communicate those details, because it's pretty important. It's the selling point.
Okay, yeah, sure. Anything that helps with the
Okay.
sale. Because
So
I think also when you explain, probably I'm guessing it's a good way also to build credibility, right? When you go into these details with the client, that when you take the time to actually explain everything.
yes, not just, hey, let's sign up for a 12-week and hopefully it works for you.
Yeah, yeah. Because that
Educate
shows you
themselves.
care when you
Mhm.
think about all the details. Yeah.
Right. So basically, what I tell them is, our doctor will usually start them on the lowest dose. Let's say it's semaglutide. He'll start them on the lowest dose. Actually, that applies to semaglutide or tirzepatide. And their body will start to lose weight over the next week or two. Um, and then they'll plateau. And when they plateau, that's when it's time to increase the dose of that medicine. Our doctor will increase that. And then the cycle continues until they've reached their goal. So it's not a one size fits all at our office. Not like, hey, Irina, at week 3, we're going to take you to this dose. We're actually having you come in each week and you're going to weigh in and we're going to cheer you on. We're going to get we get a little crazy around here.
I
We
love
really
that.
are we're cheerleaders for the patients.
But
um,
I think that's super important because you know how it is. A lot of patients they need the motivation to keep going,
mhm.
right? So I love that.
I think that probably sets us apart too, because we really do get their family. I mean, they're coming in for 3, 6, or 12 months. And I
See
mean,
them so
we
often.
know about each other's lives. And, you know, Aunt Thelma has cancer, bless her heart. I'll say a prayer, things like that. But once, once, um, once they've hit their goal, then they're going to need to go through maintenance. And maintenance is 2 to 3 months. And then I'll tell them our doctor will usually have you do the same dose, stay on the same dose instead of increasing, and the same weight for that 2 to 3 months. So then your body has the chance to become familiar with the new you and you don't shift back. So we want to help them lose weight, but we also want to help them keep it off. So now what we've done is we've created, it's math. It says, okay, well, they want to lose 30 pounds. You know that 3 months of the injections is going to be a good option, but then maintenance is another 2 to 3 months. So now it's safe to say, without discounting a doctor, I'm educating them on how our doctor works.
Mhm.
That about 6 months would be a good option for them. Of course, let them know there's no obligation if they just want to let their body see how their body responds to the 4 weeks that we've currently got going, the 4 or 6 weeks that we've currently got going. That's perfectly fine. But let them know what their options are, because what you're doing is you're creating predictability, and predictability is the key to soothing people's souls. It gives them that confidence to say, okay, this is where I am, and this is where this is potentially when I'm going to stop. Because two of the most common side effects is, if I stop taking this medicine, am I going to gain my weight back?
I
Or,
bet you get asked a lot.
yep, mm-hmm. If I stop it, am I going to gain this weight back, or am I going to have to stay on this forever? So when you give them that maintenance, 2 to 3 months, some patients do the injections every week. Some of them do them every other week. Again, it's not a one size fits all. We just have them listen to their body, and we can see it when they're coming in each week. That's where they get that predictability, and then that also is what is how they lock in.
Are there any other ways you have to build credibility with when you get on the phone with someone? Like, what's your intro? How do you how do you start
What's
the
my
conversation?
intro? Hold on, let me think. Because I don't. Basically, I would say, hi, Irina. It's Ashley with Willow Park. I'm reaching out in regards to your interest in our weight loss program. We're so excited to be a part of that with you. And then I'll just go into asking them questions, because if you ask the right questions, you will get the right answers.
Right,
So
exactly.
whoever, I think that's important, is you have a checklist of the right questions until
Oh,
it's
so
just
you
locked
have it. Yeah, well, obviously now you have it memorized, but for
in.
someone, I guess, starting out, that I guess it would help to have some kind of
Yep.
checklist.
hmm Because
Okay.
in my head, as I'm communicating to them, I'm having to hit all of these bullets to make sure that I'm answering the questions before they even get asked.
I like that. Um, what about text message? Let's say you texted, you didn't get a hold of them on the call and you know, you're chatting back and forth. What's your next step? Do you try to get them on the phone to talk to them, or do you just convert them via text?
My first attempt is a phone call, of course, because I really like to talk to people. And then, yes, I will send a text. And I'm still exercising the communications in those texts. I've got to the point where I've asked them a series of questions. I'll say, okay, thank you for your interest in our weight loss program. We're happy to be a part of that. There are a series of questions that we need to ask you before we get you added to the schedule with the doctor. is now a good time to take a call? If not, give them three choices of what your schedule could be. Okay, well, if not now, I have Monday at 11, 1, and 3. Instead of saying, when is a good time for you? Because what will happen is
Oh,
you'll message back and forth 25. So give them three options.
I like that. Okay. That's actually new to me. I'm learning a lot from this call too. Um, how do you make them feel, I guess, how do you make them feel comfortable in choosing your services? Because now let's talk about, there's competitors, weight loss, especially if we're talking about weight loss, it's pretty competitive niche right now. So how do you make them comfortable choosing you versus other competitors? Like, do you talk about price? Do you even talk about that? Do you even,
Honestly, it doesn't even enter my mind.
hmm,
I think if I let myself think about that, it might put me into a fear-based state of mind. I'm not sure. Um, I don't. In my mind, there is no competition.
do they ever say, well, down the road it's cheaper or, or like,
No,
no. Okay, so you don't have to handle
no,
that.
no. I mean, maybe 1%,
Yeah,
maybe 1%, but we're pretty competitive with our pricing too.
okay.
Um,
That helps for sure.
it's cheaper down the road.
I don't know, so I'm just throwing that in because there is like
That
pricing
is a
will be
good
pricing
question.
objections for some, not for everyone. It sounds like that's not you don't have to deal with that problem, but I've seen that before.
Yeah. Yeah, no,
Um,
we don't really deal with that. We don't, that's not really a struggle at our office. And even when I'm talking to somebody, um, no, it doesn't enter my
it
mind.
hasn't been. How do you create urgency without putting pressure on a client to make that decision to opt into into your weight loss program?
How do I create the sense of urgency? Let me think
I
about
wonder if you get, well, it's like, okay, let me think about it. Yes, I've seen that before. It's like, oh, let me think about it and get back to you. And obviously, once they're off the phone and they go back to thinking about it, we don't know
Let
what.
me think about it. I don't really, I don't really push them. I'll say, okay, well, when you decide that you're
Okay.
ready to do this, we'll be happy to, support you with your weight loss journey. But also, part of my protocol is I'll add their emails to our emailing system, and then they'll get educational emails as well. So we're continuing to plant those seeds.
Hmm.
And at some point, I mean, many of them, if they don't reach out to us right whenever we get those leads that are uploaded into that spreadsheet, they at some point they'll click on one of our emails. Or there was just one, I need to add this to the spreadsheet. Actually, there was just one that was from our last promotion, and I don't even know how long ago that's been. I just recognized their number. They
Oh,
didn't even
wow.
apply the
I'm
last
surprised
time.
they
This time
recognize
they
it.
did, and now they're signed up. Yeah.
One more question I'm thinking of. How about payment? Do you get the payment on the phone while you're talking to them, or do you send the link? How do because let's say they're ready to go. How do you kind of make that quick and smooth transition so that you sign them up as a client? How do you do that next step?
I'll tell them, well, our doctor does require, or our provider does require a deposit to get entered into the schedule. And it's $149 at our office. And then usually when I get to that point, they'll provide their payment information. We'll run the payment. And then I'll ask them, would you like for me just to run the deposit or the full amount? What's more comfortable for you? But most of the time, honestly, they just do the whole amount. Or the sense of urgency would be, we just have this special and it ends on this day. If they are not able to get in, if their schedule does not permit them to get in before that day, that deadline, well, you can go ahead and lock in and just knock out the whole thing right now and come anytime. They don't lose their credit.
That's awesome.
Mm-hmm.
Okay. Is there anything, Ashley, again, thank you so much for your time, and I'm sure this is going to be valuable for so many of our clients. Is there anything else you'd tell, someone who follows up with leads? Any other secrets, anything else you can share with them?
Mm, I think that pretty much I think that pretty much covers it. Just, if you don't make contact with someone day one, follow up again in the next 2 to 3 days.
How many,
And
talking about how many touch points, how many follow-ups actually do you do?
until they say stop.
Okay, I like that. I like that
And make
approach.
sure your people that you're trying to help out with this, don't be afraid to reach out to people just because they don't respond. I keep going until they say stop. Yeah.
I like that because at least at that point, that, they're not interested then. But
Mhm.
based on what I see with you, people don't say that because most of them actually
No,
convert.
they don't. Mm-mm. But it's really honestly just a mindset.
Mm.
Because what I've noticed with other people that I've tried to train is that fear of rejection is pretty big. Like, oh, what if I call them and they don't want this? What if I'm bugging them? And all the what ifs are there. But then if you just remove that to say education, no, for the person making these calls, they really need to be educated on what it is that they're promoting.
So they have to
Because
know it inside and out and be
yep,
confident to talk about it. Because
mhm,
if there's hesitation, then I guess it's on the other side, it comes across as like,
right. Because if they're not confident, the number one way to kill a deal is fear, because fear
Mm.
stings horribly.
I love that.